Hi, everyone. Thank you so much to Lisa and to Miranda and everyone at ALD Alliance for having me. My name is Sarah Stoney. I'm a licensed clinical social worker at CHOP. And today we're going to talk about something that you all interact with, but rarely get meaningful support around, and that is navigating the world of insurance. My goal is that you walk out of here prepared to deal with insurance, and that you feel as though, as providers, that you can help families walk through that process as well. Let me walk you through what we're covering today. Here's the roadmap. We are going to start with basics, talk about the different types of insurance, a few key terms that really matter specific to ALD. Then we'll walk through authorizations, denials, appeals, and how those decisions affect access to MRIs, gene therapy, transplant, and other medications. We'll also talk about Medicaid pathways, waivers, long-term supports like DME and travel resources, and some financial tools that can really make a difference. Towards the end, I'll show you what families can keep in their insurance survival packet. And we'll finish with key questions to ask insurers on where families and care teams can turn for help. I'm a fast talker. We'll get through all this in 30 minutes. To start us off, I want to ground the conversation in the role of advocacy, because navigating insurance really is a form of advocacy. This graphic captures something core about rare disease care. Families often become advocates in ways they never expected. Navigating insurance is not intuitive. It's not taught. There's no school you can go to figure out how insurance is navigated. But for families who enter this world of ALD, it becomes essential. And advocacy often starts not in the clinic, but in phone calls, portals, appeals, and conversations with insurers. And that's because in ALD, timing matters. In ALD, nothing about care is casual or flexible. MRI surveillance is time sensitive, endocrine monitoring is time sensitive, and a delay in authorization can delay life-saving intervention. Families face denials for genetic testing, out-of-network specialists, and high-cost therapies, and insurance literacy directly reduces both delays and financial stress. So most people begin this journey without that literacy. Ben Hendel, an associate professor of economics at UC Berkeley, was quoted in a Huffington Post article back in 2015, saying that insurance literacy matters a lot. People who have a lot less information end up losing quite a bit of money, sometimes up to thousands of dollars. Nearly 3/4 of insurance buying public falls into this medically illiterate category. In ongoing research, an assistant professor of economics at Carnegie Mellon and his colleagues found that 71% of people surveyed couldn't define basic cost-saving terms or features of their healthcare plan, including terms like deductible, copay, coinsurance, and out-of-pocket max. So the fear that people who lack insurance knowledge often lose real money is accurate. But in ALD, the cost is more than financial. That cost can be equated to access to medications and to treatment. So let's first start to talk about billing, something that confuses almost everyone. Billing mistakes do happen. Coding mistakes, duplicate charges, incorrect insurance processing, especially in complex care where families have frequent imaging, labs, and specialty visits. Families do not need to be experts in coding. They do not need to learn how to argue and fight with insurance companies. One key opportunity for families is to compare their bills to their explanation of benefits and requesting itemized bills whenever something feels off. When hospitals are alerted of these discrepancies, it often can save families immediately. Small steps like this prevent huge headaches later on. Now I want to talk about why organization is one of the most powerful tools families can have. Knowledge is power, like Samantha said earlier. Staying organized makes everything easier. A medically necessity packet with MRI schedules, diagnosis codes, endocrine guidelines, letters of medical necessity, we'll talk about this later, speed up authorizations and appeals drastically. Tracking insurance interactions and keeping emails into a dedicated folder. I've even had families actually create a separate email address just to store all of their email communication so that it's all in one dedicated location. And patient portals. Since the Cures Act, a lot of our detailed medical documentation is much more accessible to us than in the past. So let's take advantage of that. We can ensure that families know to ask for insurance case managers or patient advocates whenever possible. This is a resource that's strongly underutilized, but we advise for for all of our patients and families to make sure that they have access to that one dedicated person at your insurance company. We're going to talk briefly about the types of insurance. So here's a quick overview of the three major types of insurance families may interact with. First, commercial insurance. This usually comes through your employer or is purchased individually. It often has tighter networks, requires a lot of PAs, which can affect access to ALD specialists. We can also group the ACA plans into this category as well. Next is Medicaid. Medicaid can be income-based or disability-based. It covers medical care as well as additional supports that are really important in ALD, like transportation, home-based services, and finally, Medicare. Medicare becomes relevant for adults who qualify through disability, and each type works differently, and understanding that those differences helps families anticipate where barriers may show. It's also possible and likely to have more than one of these types of insurances, so knowing how they work together is also very important. And one major tool that works alongside insurance, especially Medicaid, is the waiver system. You may have heard these terms interchangeably just in your communication with families. So insurance covers the medical side, MRIs, labs, medications, hospitalizations. Waivers covers the support side. I actually once had somebody from the Department of Health explain it to me that they're called waivers because they, quote, waive all the guidelines of Medicaid. So that's another way to remember it. So things like home modifications, vehicle modifications, home care, personal care, respite, and I'm not saying that every waiver covers this length of support, but a lot of them do. It doesn't replace medical care, it just supplements it. And some waivers in some states open the door to Medicaid based on disability rather than income, which is very important. We'll look at some of those key terms that we talked about. Healthcare.gov actually has a really great comprehensive glossary that I advise families to go to look at that can help break down some of the insurance jargon that families hear day to day. Understanding the difference between a deductible and a co-insurance is critical when you're trying to understand what your insurance plan covers. I strongly advise that you go to the website, click on things that you've heard that maybe you don't know or understand, and then that way maybe you'll just be a little bit more informed. And knowing what these mean can also mean that you can plan your healthcare accordingly. So for example, understanding what your out-of-pocket max is may actually determine when you prefer to see your specialist throughout the year. So if your insurance plan renews in January and you have a high out-of-pocket max, you may want to get a lot of your specialist visits done in the beginning of the year to try to hit that a little bit earlier. Another good example is just understanding the difference between an EOB and a bill. An EOB is the explanation of benefits, which can be anxiety provoking when you get it in the mail because it has a lot of figures on there that isn't very clear about what they're trying to tell you. But a bill is actually when all of those charges drop and you understand what you actually owe the hospital or the physician. Learning a few more key terms. Navigating insurance for ALD requires understanding how insurers actually decide how to approve or deny care, and these processes determine access to MRIs, genetic testing, endocrine care, specialty medications, transplant, gene therapy, and the list goes on. Prior authorization is required for almost everything in ALD, and the #1 cause of delay is missing documentation. Medical exemptions help families access medications that are not on a plan's formulary, and step therapy exemptions are critical because ALD doesn't have lower tier alternatives. And single case agreements allow temporary in-network coverage for out-of-network ALD specialists and for transplant centers. We see patients, and this is very common if you have either primary Medicaid or even secondary Medicaid. If you're going to a center out of state, most state Medicaid plans will not pay for care out of state. So it's really important for those hospitals to be submitting SCAs to explain why their center is where the child needs to come for care. And even with these tools, families encounter obstacles. We consistently see challenges around MRI frequency limits, genetic testing for relatives, specialist access, endocrine care for adrenal insufficiency, transplant access, and high-cost therapies, including gene therapy. Delays during adrenal crisis situations can be dangerous, which is why insurance speed does matter. And choosing the right healthcare plan can help prevent some of these issues. So when families are comparing insurance plans for ALD care, there's a few key things I encourage them to look for. First, whether the plan care covers at an ALD or leukodystrophy specialty center, because that determines who they can actually see. It's also important to look at whether the plan offers out-of-network benefits or can approve those SCAs or single case agreements we talked about, since many ALD specialists are outside of standard networks. Families should review how the plan handles MRI authorizations and any limits on imaging frequency. Genetic testing, genetic counseling coverage is also a major issue, and also transplant access. And then there's the drug side, understanding where specialty medications fall in the tier structure and what the out-of-pocket costs look like. This slide also includes questions families can bring directly to insurers. These questions help reveal whether a plan will likely support ALD-specific care, asking things like, is gene therapy covered, or whether those single case agreements are allowed, or how they define experimental and investigational, which is a lot of insurance companies' way to describe gene therapy, is really important to know ahead of time. Gene therapy is often categorized as high-cost specialty care, and insurers may label it experimental or investigational. Families need strong documentation, FDA approval status, clinical guidelines, specialist letters, and evidence of progression. Peer-to-peer reviews do help. Getting your care team on the phone with insurance companies directly oftentimes can make a difference. Advocate for you and your families to get your physicians on the phone. Manufacturer support programs can help, and appeals, both internal and external, are often necessary. So we'll walk through the denial process in a little bit. Okay, most denials are reversible. Families should request the denial letter. Physicians do get a copy of this, but it's often delayed. So I tell families, like, the second that you get it over to your physician so that they can start the process. I can't tell you how many times we get a denial letter that was dated 2 weeks ago, and we have exactly X amount of hours to respond or schedule a peer-to-peer. So it's really important to communicate with your care team the second you know that something's been denied, so that they can take the right actions. And also, too, the denial letters will say explicitly why it was denied. 9 times out of 10, it's typically an easy fix. It's usually something that can be corrected with the appropriate documentation, and really just getting your care team to submit that correction is what's helpful. Peer-to-peer reviews, as I mentioned, can be very effective. If needed, families can escalate to external review or file complaints with the state insurance departments. Like Samantha mentioned, it's not fun, but it's certainly a part of learning how to advocate for you and your family. The equality of the appeal really matters. A strong appeal includes diagnosis codes, MRI and endocrine guidelines, excuse me, specialist letters describing urgency, clinical timelines, and supporting literature. One phrase that carries a great deal of weight is, "This intervention is medically necessary to prevent irreversible neurologic decline." Also, ensuring the timeline of symptoms and prior imaging, supporting literature and clinical guidelines, all of that, making sure that it's included. And now that we're having this discussion in 2026, we have to address AI. So AI now automates many denials before a human ever looks at them. It flags rare disease care as outliers because training data excludes rare populations. It misclassifies genetic tests, MRIs, and gene therapy as not medically necessary or experimental. It generates generic denial letters quickly, which speed up denials and slows down access. If you've ever gotten into denial where you're reading it and there's quite literally verbs missing and it doesn't make a lot of sense, you can pretty much understand how that was generated. The good news is that strong clinician documentation can often override these errors. Talk now about getting Medicaid. We'll now shift into just kind of talking about Medicaid pathways, starting with children. So very, very, very important, if you take nothing else away, understand that children can qualify for disability-based Medicaid even when their parents' income would normally disqualify them. This is so, so, so important. I am terrified when I meet families that are not at the beginning of their journey, that are not already looped in with a program that is available to them, because it will save you a ton of money and give a lot of access to your child for the things that they need. Pathways like the Katie Beckett waivers or other state-specific programs are really essential. The problem is that medical Medicaid is not a federal program. And when I say medical Medicaid, I just mean Medicaid where you're eligible for medical reasons, not for income reasons. So that's what I mean when I say that term. It's not federal, so it's different in every state, which means that depending on where you live, it really determines your access to medical Medicaid. As somebody who works at CHOP, I know many states, probably more than I should, know the process to how to get Medicaid in many, many different states, but it's very important that you talk to your care team about whether or not there's access in your state. Not every state has a great access program, but your care team should know, regardless of how easy or hard that path is, what that path looks like. I also copied the top of this website. This is not a paid endorsement. I don't know actually who runs kidswaivers.org, but I will say it's incredibly reliable. So it has a state-by-state breakdown. You can go to each state and figure out what programs are available in that state. I find the information I don't necessarily take 100% is they do list the wait list for a lot of the waivers. I find that some of that information isn't accurate, but it has where you go to apply for the waiver, what exactly it provides, and I've cross-checked it with a lot of my own research, and I find it to be really helpful. So definitely something that I would recommend. Okay, and for adults, switching gears a little bit, support can look a little different. Adults access services through home and community-based services. Oftentimes this is waivers or long-term services and supports. This can include personal care, respite, home modifications, and transportation, all obviously very crucial as ALD progresses. And these are also state-ran, but much more consistent across state lines. So based on the state that you live in, you oftentimes have access to these adult services. And this leads into durable medical equipment and home modifications, which are essential in ALD. For some families, this may mean mobility equipment for things like wheelchairs, walkers, or other mobility aids. For others, it's bathroom and toileting safety, equipment such as shower chairs, lifts, or grab bars. Communication devices and home modifications are always important. Bathroom changes or widening doorways. Anything that can help maintain safety and independence and dignity as needs evolve. For many families, in-home nursing and personal care hours also becomes a key support, especially during adult ALD and later stages of cerebral ALD. What's tricky is that the coverage varies drastically. So commercial insurance, Medicaid, and waivers all approach these supports differently. Commercial insurance may cover only the bare minimum or nothing. And Medicaid might cover more, but sometimes with strict rules. PA Medicaid, I can speak, I work in Philadelphia. There was a class action lawsuit that some of my patients were a part of, where they actually sued PA Medicaid and said that home modifications are medically necessary. And they won, which was amazing. And now PA state Medicaid covers some home modifications. It has weird loopholes, but it's still huge progress. So for example, they'll pay for a ramp to go in, but they won't pay for like the construction to put in the ramp. But those are things that we can figure out. So Medicaid can pay for some home modifications, but oftentimes a lot of that money also comes from waiver programs. The big key thing I want you to understand for travel and lodging is that Medicaid can often help. When we have patients coming to CHOP from all over the country, if you have a state Medicaid, you can ask, do you get any travel assistance? Oftentimes Medicaid can sometimes help with things like flights or hotel arrangements. And if not, there are often other supports, making sure that you're talking to, if your insurance company can't help, making sure you're talking to hospital social workers to talk about Ronald McDonald House or other lodging supports. And then our rare disease community is incredibly supportive for travel costs as well. So some other financial tools that can really help manage ongoing medical costs, savings accounts, or flexible savings accounts and health savings accounts are both pre-tax options that can reduce out-of-pocket expenses. As a refresher, FSAs, it's gonna be a speech exercise. FSAs are typically use it or lose it, and HSAs roll over from year to year and can be a long-term resource if a family is in a high deductible plan. ABLE accounts are really incredible. They have been here for probably about 10 years, maybe a little bit less. ABLE accounts are another important tool. These accounts really allow people to save money without jeopardizing the eligibility for Medicaid or SSI. And the funds can be used for a wide range of disability-related expenses. The acronym literally stands for Achieving a Better Life Experience. So anything that falls under that very large umbrella is what the account can be used for. The other thing that's really great about ABLE accounts versus special needs trusts is that ABLE accounts can be self-directed. So individuals themselves that have a disability can have an ABLE account and not risk losing access to Medicaid or Social Security. And the thresholds for savings are actually quite high. I haven't looked recently, but the last time I did, the PA ABLE account thresholds were, I think, 100K for losing Social Security benefits and 300K before you lost Medicaid benefits. So really important to know. There are still special needs trusts, which have the same protections as ABLE accounts, but they're maintained by a trustee and aren't self-directed. Okay, some additional strategies that families can use when trying to face their medical bills or unexpected costs, really asking about payment options with their hospital plans. Many hospitals offer no interest payment plans or financial counseling to families, and families don't realize that these supports are available. This is huge. Request payment forgiveness or charity care. I cannot tell you how often hospitals have the ability to forgive bills. I can speak to just CHOP's process. Our financial assistance program is, our income threshold is incredibly high on purpose because we want to cast a wide net to be able to help working families that are either uninsured or underinsured. Dispute incorrect charges using AMA CPT code guidelines. Again, you don't need to be an expert. You don't need to understand codes. Just comparing that EOB to the bill can really identify where those mixed matches are. Another strategy is requesting that itemized bill, again, matching kind of what's in the EOB with what you see. Looking for rare disease or diagnosis-specific groups through nonprofit or advocacy groups. And if you have one, access to a hospital social worker, because oftentimes we have access to other organizations or charities that maybe the community may not have access to. So hopefully I will speed up. The insurance survival kit is something that we talked about early on. I suggest that every family have this, whether it's electronic or whether it's actual paper. This is one of the simplest tools that families can create, and it ends up being one of the most powerful because it saves time, prevents delays, and keeps everything and everyone on the same page. So this packet should include your ICD-10 codes for ALD, your child's MRI surveillance schedule, the endocrine guidelines that support adrenal monitoring, and it's also important to keep copies of a formal diagnosis letter or a genetic confirmation report, along with up-to-date contact information for all the providers. Neurology, endocrine, social work, primary care have their direct lines all together in one spot. And families should also hold on to copies of prior denials or approvals because oftentimes they become important when insurers question the need for ongoing services. And finally, I always recommend including the most recent MRI and reports, any key labs, because these documents are frequently needed during urgent authorizations or peer-to-peer reviews. Having this packet ready also makes every step of the insurance process on authorizations and appeals, even urgent requests, go a lot faster. And as we already mentioned, time matters when it comes to ALD care. So once we build this packet, who can actually help us put these packets together and who can help us in general? So most importantly, families are not expected to do this alone. We talked about this in the beginning. There's no school that you can go to understand how to navigate the complex world of insurance. There's no class that you can take, and we know and understand that. So there's a whole network of people and programs that help navigate you through the insurance system. Hospital social workers and care coordinators can support families with authorizations, denials, accessing community resources. Financial counseling and billing teams can help interpret bills, and you set up payment plans or even help you apply for financial assistance. Specialty clinic insurance navigators often know the nuances of genetic testing, prior auths, and high-cost therapies better than anyone. Insurance managers or insurance case managers, the ones assigned through the plan, and I'm careful with this because sometimes insurance companies call them something different, so they also can be health advocates or insurance advocates, but they're the insurance case managers. They can also help coordinate services, referrals, and approvals on the insurer side. Customer assistance and state Medicaid offices are also there to help resolve issues when plans aren't following policy and when families need help understanding their rights. And for bigger problems, families can pursue fair hearings and even reach out to their state's legislation office when something is, when families don't realize, there's not an understanding of what exactly a family's rights are and what they're able to do. ALD and rare disease organizations are a huge help in providing support, peer connections, and lived experiences. And while the entire system is complicated, families don't have to walk this path alone. So really understanding that these are all individuals that can help you walk through these processes together. And here are just going to bring everything together in a quick summary. So what you need to know about insurance and ALD. Insurance decisions impact access to time-sensitive ALD care. Prior authorizations, exceptions, SCAs are common, and it's really important to know and understand some of those terms and who your key players are. I always tell families, even if this is something that you're not sure you can navigate yourself, at least be able to identify that person, that social worker, or that doctor who you can pick up the phone and call and can help you through it. AI-driven and automatic denials are increasing. So make sure your care teams are helping you overturn those decisions. Medicaid pathways and waivers are critical. If you remember nothing else, please go to your doctors if you haven't already and ask them for a path to get onto Medicaid for your child. Traveling, lodging, DME are all home supports that can be available through Medicaid or waivers. Keeping that insurance survival packet we talked about really can speed up processes, and families, again, are not expected to do this alone. It's really important that you reach out to your care team and ask them for help and advocacy. Even if your hospital doesn't have a social worker, you can ask them to speak to the financial assistance team or other providers. Even I was telling someone earlier, my nurse is going to an appeal hearing next week. And the medical team can also help you through some of these processes too. So make sure that you just ask for help. And that is my contact information. Any questions? It's a lot in 30 minutes. Okay.
Oh, you're getting applause. Yay! That really was such a great talk.
Thanks.
So I think the answer to this question is probably on your what else can I do slide, but maybe for this particular situation, there's a more specific answer. What would you recommend to avoid out-of-pocket expenses for families that need to go out of state for a transplant or want to use a preferred transplant facility / medical team? Medicaid.
If they have to access, so another key thing to remember, if an individual has Medicaid, they can't be balance bill. And what that means is basically that your medical care is covered at 100%. And that's gonna seem confusing to people, especially if it's secondary. So it doesn't mean that the process is easier. It just means that once the primary pays for what they're gonna pay, Medicaid is gonna come in and if approved, is gonna cover everything that the primary doesn't cover. So that is gonna help with medical expenses. And then if Medicaid is involved, then the hope would be that they also could assist with some travel reimbursement or travel assistance. I also would connect with the care team that you are going to, because it's likely, if it's a leukodystrophy center, we are all very used to people coming from all over the land to come to our centers. So we're very used to working with different state Medicaids. And we oftentimes have automated letters and different materials that we can give insurers to explain why a child needs to come to our center versus somebody else's. So really kind of involve those team members.
So you had mentioned about prior authorization, like if the doctor should get it, and from my own personal experience, MLD, not ALD, so many times I would get this huge bill. I mean, I knew I had a deductible, but insurance didn't cover it because they didn't get the prior authorization. And for some reason, it always used to happen with cardiology. So I think when the person, any parent, especially new parents that are making the appointment, always say, do I need prior authorization? It's a simple little statement and it covers yourself, because then you could go back and fight with them. And I do fight, sorry.
Yes.
But I do, because if they didn't get the prior authorization, it's not my fault. And I've had bills written off because of that.
Yes.
So I always make sure I ask that question. do we need prior authorization?
Absolutely, absolutely. And I didn't include this because the statistic is a little outdated, but 5 years ago, if you looked it up, they would have said that the internet would have said that like 80% of medical bills are incorrect. That statistic still lives around like 40%. And oftentimes it's things either being duplicated or they don't have the right insurance on file or they're not, they didn't have the right authorizations in place, which when you really lean in even a little bit, hospitals have a tendency to recognize their mistakes pretty quickly and make sure that they're fixing things. But that's a great example. Another example I had is I had a family that had primary insurance, a commercial plan, and then secondary Medicaid. And I got consulted to help them with bills, with medical bills, which immediately confused me because I said they have Medicaid, they can't have medical bills. And here it was like that we didn't have their Medicaid on file, so we were never billing them. And we had a lot of cleanup to do, and we did. But it's something, it's really oftentimes just clerical errors or some sort of error by someone who ordered something without the right authorizations, and those things can all be retroactively taken care of.
And I have one more little tip.
Yeah.
Because I didn't have secondary insurance from one of my children. So when we did bills, I mean, I have a husband, but if you have a partner, a spouse, a lover, whatever you have, I just I handled all the medical part of the bills and my husband did the other piece because just made it easy instead of one person being inundated. So if you could split that task and one person, I mean, I even went as far as having a little checkbook because it made sense for us.
Right. Absolutely, absolutely. I mean, doing all of this requires such a great deal of organization, and it is very, very difficult. So understanding just in a house who is going to be key to be able to navigate these problems better is absolutely brilliant. And to comment on the first thing you said, New Jersey does not have a good medical Medicaid plan, so that is why you did not have access to Medicaid. But like, New Jersey is actually one of those states that it's through a waiver, and it's like very difficult. New Jersey does some things like really, really great. They don't have a great plan for that. But yeah, great point. Any other questions?
I was just going to ask specifically, like ALD related, do you have any experience or know any stories about a private insurance or an employer-based plan ultimately covering it in full?
Yeah, absolutely.
And how that, I guess, went, if you could explain that.
Absolutely, that's absolutely possible. It's just, the commercial plans are so irregular and don't typically follow like standardization that it's really difficult to sometimes know. There's just such variability in like from one insurance plan to another. We've absolutely had things covered at 100%. When I talk about Medicaid, oftentimes I'm looking, even though it's like day of diagnosis, sometimes I'm looking like 10 years in the future, and I'm looking at like, you know, $40,000 electric wheelchairs or those home modifications or different things like that. It's not that they're not covered by insurance, by commercial insurances, they absolutely can. But that's why it's so important to know what those commercial plans are. Even some of my families with TRICARE will opt not to go for Medicaid because they say that their coverage is really great. But yeah, if you know that your commercial plan really covers those things that you know that you're gonna need, then that's key. You don't, but you can ask them some questions. I'm gonna go back to it. You can ask them specific questions that are general, that kind of inquire about just overall ALD care. Hold on, I'm going too fast. Here, yes. So these are questions that you can ask insurance companies, and you can even do this when you're shopping. Like, so a lot of our families will tell us like, hey, we're shopping for new insurance, what should I ask? And we have, these are like curated questions. I have a few more that we've figured out like families can legally ask insurance companies and they have to tell them. So these are kind of some of those examples as to what, just so that you know ahead of time, is this something that is gonna be like completely off limits, or is this something that, okay, you're gonna need authorization for? For the most part, leukodystrophy centers, I mean, because we work in rare disease, your medical teams are bulldogs. Like they're gonna fight for you really, really hard. So if there is a will, there will be a way. You guys survived an insurance talk, yeah.